Hi, friends. So, this one's a little bit of a nuanced question because we are ultimately an educational system, not a healthcare facility. But it's so important for us to recognize that to educate the whole child, we have to embrace the fundamental truth that strong academics and strong mental health are completely intertwined. We simply cannot have one without the other. So, our core mission of educating the children is undermined when we treat wellness as an afterthought, especially as our students are navigating this unprecedented, incessant stressors of 24/7 social media, that pressure cooker environment that research is showing is leading to some of the highest rates of anxiety, depression, and substance use, even in, or especially in, affluent suburban school districts. That is why I've consistently advocated for a two-pronged approach that addresses both prevention and treatment. So, first, we must intentionally embed essential life skills into every part of our district wide experience. My approach is grounded in the work of two psychologists, Dr. Stuart Ablon, who's at Harvard Medical School, who reminds us that it's not about strengthening a child's will, it's about building their skills in things like problem solving and flexibility and frustration tolerance. And I pair that with insights from Dr. Guy Winch, who advocates for teaching what he calls emotional first aid. He points out that while kindergartners will easily answer the question of how do you handle a paper cut on your finger, they often don't know how to tend to what he calls the psychological paper cuts that we all experience, things like rejection and loneliness that you feel, for example, when you aren't invited to a birthday party. So, by integrating these kinds of skills based learning into our existing arts, academic, service learning, leadership programs, we can equip our students to navigate the challenges long before they come crises. We can also expand this work through evidence-based programs, and there's some programs that are really cool that are in philosophy or even some civics programs that will help us meet state standards while also nurturing empathy and ethical reasoning, both of which help address those psychological paper cuts. The key is to empower our faculty to carry this work forward so that it can really be embedded deeply into the core of what we were already doing. Second, I support the incredible mental health services that we offer our students. They truly are a model of excellence. They are robust, accessible supports for students who are struggling now. And that's why I've consistently voted to expand student access to mental health professionals in all of our school buildings and in building those strong referral networks. While my own dissertation work and other academic work is focusing on finding those kind of long-term root causes and solutions, our immediate duty as a school district is to act. So by combining this proactive skills-based education with the accessible professional care, we create a holistic system that prepares our students to flourish, not just in our classrooms, but in the complex world that is awaiting for them.